Go ahead, ma'am.
Okay. Yeah. So good afternoon, everyone. I'm Dr. Sayali. I'm the consultant and fertility specialist at Oasis Fertility, Pune. So I welcome you all for today's Facebook Live session, and we'll be dealing with a topic that is what is a good AMH level to get pregnant today. So prior to moving ahead to this topic, let us understand what AMH is. Now here, AMH is a hormone that is secreted by the granulosa cells, of the ovarian follicles inside your ovary. Now, what does this AMH do? AMH ideally regulates the growth and maturation of the eggs that are inside the ovary. This is a significant biomarker to assess the ovarian reserve in an individual, and this in turn is going to predict the future fertility or the fertility potential in this individual. Now, AMH hormone is present since birth, and this is going to decline over the period. Now, here you have to understand that this AMH hormone is secreted by these small follicles that are there inside the ovary. So, every woman is born with a certain reserve of eggs. Now, these eggs are in millions at the time the woman is born, and they come to around 4 to 5 lakhs at the time of puberty. So with every menstrual cycle, the ovarian reserve or the number of eggs are going to decline. So this AMH, which is secreted by these follicles, is going to give us an estimate of the reserve of the egg or the number of eggs that are remaining inside the woman at that particular time. So this in short is going to give us an indication of our fertility potential, means do we have the sufficient time to attain pregnancy or should we resort to any form of treatment, which can hasten our success, of attaining pregnancy. So basically, it is going to tell us what is the time to pregnancy. Like, should we try by the natural method or should we get any assistance so that we can hasten our fertility journey. Now, here is what does AMH test determine. So, whenever an individual wants to plan fertility, her fertility specialist will ideally tell her to go ahead with this AMH testing. Now, AMH is basically a blood test that can be done anytime in the menstrual cycle, and this is going to measure the concentration of this AMH hormone level in the bloodstream. Now, this is one of the most prominent methods to evaluate a woman's fertility. Now, when is your fertility specialist going to recommend the AMH test for you? So basically, when an individual, she wants to conceive and she wants to get her fertility potential tested, uh, you know, uh, now there are certain individuals who are having irregular menstrual cycle. So this AMH can also help us determine whether she has an excess of eggs, that is, she's a case of PCOS, or her ovarian reserve is on the lower side. This AMH test will also help to predict which fertility treatment is going to work best for the particular individual. And in individuals who are of the advanced age, like whose periods are getting irregular, this will also help us anticipate the arrival of our menopause. Now, when we are talking about this AMH level, this is usually measured in nanogram per ml, and the values between 1.2 to 3.5 is considered as a normal AMH level. Now, a normal AMH level means that the woman has sufficient, ovarian reserve or sufficient number of oocytes inside her, so she can plan her pregnancy by the natural method, and she has sufficient time to plan her pregnancy. Now, when the AMH level go on the lower side, that is when the number of follicles begin to decline. Now, here the value of your AMH is going to come less than 1.2. Now, when your value is less than 1.2, it indicates that your ovarian reserve is declining. So, you should speed up your fertility journey. You should, assort to methods that are going to increase the chances of you conceiving. So rather than going ahead with a natural trial, you can meet your fertility specialist and they can assist you in terms of your AMH level or the number of follicles that are remaining inside. So based on your AMH and AFP count, it can guide you which form of fertility treatment, be it an IUI or IVF, can work best for you. When the AMH level is extremely low, that is, when the value of this AMH is less than zero point 0.5, it indicates that your ovarian reserve is rapidly depleting, and it's not going to be very far that the number of eggs inside the ovaries are going to get depleted. So whenever your AMH level has gone down, whenever there's a declining trend in your AMH level, it also indicates that not only is your reserve or the number of follicles declining, but it is also the quality of these eggs that are going to decline. And second thing is there's an increased risk of genetic abnormalities that are going to increase. Now, here you have to understand that whatever the AMH level, whether you have a low AMH, whether you have a normal or a high AMH, age also significantly plays a very important role in the overall quality of your oocytes or the genetic assessment of them or the number of embryos formed. So specifically, for example, if you have an individual who has a normal reserve or who has a higher AMH level, but she is of an advanced age, doesn't always mean that she will get the best quality of oocytes. Maybe age also has a detrimental factor, and the quality of oocytes may be affected, or there may be a greater chance of genetic abnormality in the oocyte, and therefore the chances of getting the good quality resultant embryos might be on the lower side, and therefore the chances of conception, even with a good or high AMH level with advanced age, will be of the lower side. Okay, the worst scenario here will be a lower AMH with an advanced age. So individuals who have a very low AMH, that is whose values are less than zero point 0.5 and who are of an advanced age, if the age is greater than 35, here the number of eggs are also declining. Here the quality of eggs will also be on the lower side, and these individuals will also have, an increased risk of genetic abnormalities in the resultant embryos that are formed, and therefore the chances of conception in these individuals are going to be on the lower side. So whenever we are planning for an IVF cycle in individuals who are of an advanced age and a low reserve, maybe with a single stimulation cycle, we might not be able to form the required number of good quality, genetically normal embryos. So in that case, maybe 2 to 3 cycles of stimulation may be required to get the desired number of embryos. So here, as we have seen till now, is the AMH value between 1.2 to 3.5 is considered to be a normal reserve. Whenever your reserve is on the declining side, the quality of the eggs, the number of eggs, and the resultant number of embryos are going to be compromised, and therefore this can decline your chances of conception. As the age advances, we all know that the quantity of the eggs, that is the number of eggs, the quality of the eggs is going to decline, and there is going to be an increase in the risk of, genetic abnormalities in whatever embryos that are formed. Now here, let us come to the reasons for low AMH level. So one of the most, common reasons for low AMH level is advancing age. As we know, from puberty, with every menstrual cycle, your number of eggs are going to get depleted and your reserve is going to decline. Okay, so age is one of the contributing factors to a low AMH level. Another thing can be genetics. We also have autoimmune conditions like such as the SLE or rheumatoid arthritis that can decline the ovarian reserve very rapidly. If the individual has gone for any form of medical treatment in the form of chemo, radiation, that can decline the ovarian reserve. Any form of surgery that has been damaging to the ovaries, that is any form of cyst removal or any form of endometriotic cyst that has been excised. This in turn will damage the ovaries, and this in turn will decrease the AMH levels. Or there are also other factors that increase in the stress, the lifestyle that the individuals are leading, the unnecessary exposure to radiation, the lack of adequate sleep, the environmental toxins. These all are factors that are responsible for your low AMH level, or basically some of these factors are also responsible for degrading quality of your oocytes, even in individuals who have a normal reserve. So as we have seen, if the AMH level is less than 1.2, there is a decline in the ovarian reserve, there's a decline in the number of the oocytes, there's a decline in the quality of the oocytes. So in these individuals, we should resort to some form of fertility treatment to hasten the chances of conception. They can get pregnant easily, and the fertility journey will be a little easier for them. And the time to pregnancy can be decreased in these individuals. But individuals who have the AMH level less than zero point 0.5, that is, they have a critically low AMH level, which means that the number of oocytes, the quality of the oocytes, they are all on the lower side. Then these individuals should ideally resort to IVF as a fertility treatment. That is because IVF is the only method of treatment which can maximize the success of attaining pregnancy. These individuals also may require multiple cycles of stimulation to get the adequate number of eggs and the embryos. But compared to the natural trial or the monitoring cycle or IVF in these individuals, give them higher chances of conceiving. So a lower AMH, as we know, is going to affect the quality, is going to affect the quality of the eggs. It is going to in turn affect the quality of the embryo sperm, increase the risk of genetic abnormalities, and in turn is going to decrease the chances of conception in these individuals. Individuals who go ahead with the IVF cycle with low AMS, the number of follicles on the extremely lower side and also increased chances of cycle cancellation. When in some individuals, even after giving very high doses of injectables, the follicles do not grow. So in that case, maybe we won't be able to get that proper dominant follicle or the expected number of oocytes, or we won't be able to form the embryos in that case. And therefore there is an increased chance of cyclic cancellation. And similarly, in individuals with a low AMH implant age, there is an increased chance of genetic abnormality in these individuals. Now, here we have to understand that even though individuals with low AMH move ahead with IVF as a form of infertility, here we have to understand that in IVF also we require the desired number of follicles. We require a good number of eggs. So in that case, because not every follicle that is growing is going to contain an egg inside it. Not every egg is going to be of a good quality. Not every good quality egg is going to be fertilized, and not every fertilized embryo that is formed is going to be genetically normal or of good quality. And therefore, it is not that if the individual has a very low reserve and has only one or two eggs, we will be able to form those many number of good quality embryos. So we cannot wait if the AMH level is on the lower side. We cannot wait for our reserve to further decline, because then even IVF as a form of treatment will not be able to give success to these individuals. Um, so, in order to maximize the chance of conception, these individuals might require multiple cycles of stimulation from the best quality of the embryo, and since the risk of genetic abnormality also increases in individuals with low MSM advantage, the desired number of embryos are formed. These individuals can also go for the genetic testing of the embryos to maximize the chances of IVF conception. Here we have also seen that age affects your fertility. In terms of age, it's going to decline the quality of the eggs that is there, because as you age, the eggs are also going to age, so the quality is going to be affected. There is genetic abnormalities that is going to increase. So somewhere down the line, the expected number of normal, genetically normal or good quality embryos are going to be on the lower side, and therefore this will decrease the chances of conception. So, is there any means by which we can increase this AMH level? So, as we have already discussed, that every woman is born with a certain reserve of eggs, and there is no way by which we can increase this reserve. And any modalities of treatment done so far in the form of stem cell, or ovarian PRP, these are all experimental with no much proven results. So, as we know, we cannot increase the AMH level, but there are methods where we can, maintain our AMH level and, try to better the quality of the eggs inside it. And therefore, lifestyle changes are definitely, going to help us. So, taking antioxidants in your diet supplementation, lifestyle changes like regular exercise, having, a proper diet, good protein meals, healthy diet, living a stress-free life, having adequate sleep, doing away with your addictions in the form of, stop quitting your alcohol, quitting sleep, the same smoking, having adequate amount of sleep. These are factors that kind of, these improved lifestyle modifications can kind of, help in maintaining your AMH level. These factors can help in getting better quality of oocytes, so we have a low reserve, and at least the chances of success, by getting the adequate number of embryos and success in pregnancy can be there if you do lifestyle modification. Okay, so I think this is all that I have from my side today. I hope most of the queries and the questions by you people have been solved in this session. So let us see if we have anything coming over from our viewers. Okay, so the first question is what AMH level indicates infertility? See, AMH is precisely a hormone level that will indicate our chances of conception. What AMH level indicates fertility? Rather than I would like to answer it in this way that a AMH level of 1.2 to 3.5 indicates a good fertility. And if your AMH level falls below 1.2, then the chances of fertility are going to be on the lower side. Apart from AMH, there are other factors also that are responsible for your infertility. Okay, so this can be, there can be some problem with the tubes or there can be some problem with the uterus. So these factors can also contribute to infertility even though the AMH levels are on the normal side. But AMH level below 1.2 and precisely below zero point 0.5 can decrease your chances of conception. So when is the best time to do the test for AMH? So this AMH hormone level doesn't ideally fluctuate at times of the day or during the menstrual cycle. So this hormone level can be done anytime. Okay. So the next question is, can I conceive with low AMH? So definitely you can conceive with low AMH. Depending upon your value of AMH, you have to understand that the time to pregnancy should be monitored. So when you have a low AMH level, then you move ahead with IVF as a form of treatment when we are selecting the best quality oocytes, taking the best quality embryos, and then transferring it. Here the chances of conception will be on the higher side. But with a lower AMH, where you know that maybe the number of eggs, the quality of eggs will be degraded, and maybe the risk of genetic abnormalities in your embryos will be on the higher side. If you want to go ahead with a natural plan or IUI, the chance of success will be on the lower side. Okay, so I think that is all that we have from us today. So thank you everyone for your patient listening. For any queries, you can dial the helpline number that is given below, or you can reach us physically at any of our two centers, that is Oasis Fertility at Kaspati Vasti Bakar or at Adisa Avenue, Kanadi.